In communities across America, doctors, nurses, hospitals, care facilities, and community organizations are working with patients to stop the revolving door of avoidable readmissions for good. In Salt Lake City, University of Utah Healthcare hired a transition navigator to help bridge the gap between hospital and home.
One of the biggest parts of my job is to make sure that things don't fall through the cracks. I screen a list of patients who are admitted daily. Then I get to work. Let's do the NIC.
Mr. Smith.
I meet with the hospital teams. They walk me through who's going home and what kind of needs they have. I meet with the patients. How are you doing? And find out when is convenient for them to go to a doctor's appointment. So the afternoons work better for you?
Yes.
I follow a patient all the way through post-discharge.
Do you have any questions?
We know that a good follow-up care plan once they leave the hospital is very important in preventing that patient from being readmitted to the hospital.
We have one of Dr. Villalobos' patients.
I think that most avoidable readmissions happen because patients don't have continuity of care.
He's supposed to be leaving today.
I think it's well known that an interdisciplinary team is the best way to take care of a patient. And that's what we've modeled this whole care transitions program from.
And I was able to get you an appointment.
No longer can we think of the hospital standing alone or the primary care clinic standing alone. The importance of information on discharge cannot be underestimated.
In Cullman, Alabama, the Regional Medical Center is focusing on the discharge process to help patients better understand how to care for themselves once they leave the hospital.
Hey, I'm Tina. I'm one of the nurses at CRMC. I'm here to do your discharge.
We have been focusing on preventing readmissions, and when we drill down to identify what is it, it's still boiled down to education.
It's very important when you give yourself injections that you clean the site.
The nurse maintains the same discharge process that they were doing. The one addition is they take in an iPod Touch device and they tell the patient, I'm going to record my discharge teaching.
What we're going to do is going to record it. This is discharge instructions.
So then when the patient gets home, they can listen to the audio.
Dr. Morris wants you to be on a consistent carb diet.
They can also see any videos that we had.
And be sure you're back on all your usual medications.
They have a link to our hospital website that has all kinds of information.
The discharge instructions for Mrs.
So we can tailor it to their discharge diagnosis. So it makes it very, very simple.
So when you get home, if you were to have questions, you'll be able to listen to everything that we've just recorded.
Okay, good.
A little overwhelmed, but it's not as scary as it was at first.
Now you're good to go, okay?
All right.
I particularly like the discharge instruction where we can go online, because now I might get home and get scared and forget what she's told me. So now I've actually got something to go back to and say, oh, okay, I didn't remember that.
When you go home, you're going to gradually resume your normal activities.
In Durham, North Carolina, Northern Piedmont Community Care helps patients manage their health when they get home.
The most important time for a patient when they're coming out of the hospital, we call the transitional period.
Hey, Karen, this is Jennifer. I'm just calling.
We try to get in contact with the patient within about 3 days of the discharge to establish a home visit. That home visit is where we usually do the biggest amount of work, where we're getting the meds together, getting the appointments set up, making sure that they have a place to live. We want to make sure that they're stable so that they don't get readmitted into the hospital. For patients, their home is where they are most of the time. So why not bring the healthcare to them?
Morning. How are you?
Oh, just fine.
Aaron Allen is a patient of mine that I've been seeing for probably close to a year now.
It's good to check and see what your blood sugar is.
He has diabetes that's very uncontrolled. Because of that uncontrolled diabetes, he has had an amputation, below the knee amputation on his right leg.
I know the first time I met you, you were in the bed.
Oh, yeah. That's why I stayed there, in the bed. What'd you get up for?
With Mr. Allen, I have seen a definite change in the home visits.
Thank you for coming.
You're
seeing
welcome.
Me. Good to see you.
I've seen a difference in just his demeanor. Now, he's got a more hopeful outlook.
Hang in there.
I am. With your help, I am.
I'm not going to be able to cure your diabetes. I'm not going to be able to take away the fact that you got an amputation or that you had a heart attack. But if I could make you believe that you can take care of yourself and that you can carry on your own future, then I've done my job.
The evidence shows these programs are working.
Okay, bye.
We're going to start recording the discharge instructions, okay?
Okay. Good to see you. How's everything going?
Oh, it's going pretty well today.
Real change is happening in real communities because they care about your care.